Hello everyone and welcome to a new video. So in this video we are going to talk about the aminoglycosides. So the aminoglycosides are a group of antibiotics that are used to treat serious infections caused by gram-negative bacilli. And the term aminoglycosides refer to their structure. Amino is from that they contain the amine group, and the glycosides mean that they contain sugar groups. And we talked about how the amine group is very good at entering the outer membrane of the gram-negative bacteria, and that explains their activity against the gram-negative bacilli. In this video, we will talk about the agents that are from this group and the pharmacokinetics, the mechanism of action, the spectrum, the resistance, the therapeutic uses, the adverse effects, and the contraindications. So let's start. Let's start by talking about the agents that are from the aminoglycoside group. We start with the first and the prototype agent of the aminoglycosides, which is the streptomycin. So streptomycin, this drug discovered in the 1940s, and it is the prototype, as we mentioned. And this drug, there is a lot of resistance against this drug. So a lot of resistance by the bacteria against this drug. So this drug is of limited use, and the half-life of this drug is about 2.5 hours. And the mycin in this name of the drug and in the other drugs, it means that the drug is coming from a bacteria. So the drug source is bacteria. So we add the mycin to the name of the drug. And it is not only the aminoglycoside that has mycin. There's other antibiotics like the vancomycin, which is a glycopeptide, and it is also coming from bacteria, so it's called vanco and mycin. The other agent that we have is the gentamicin. The gentamicin is of a half-life of 3 hours, and this drug is available topically, so it has a topical formula. The main formula for the aminoglycosides is the intravenous formula. So main formula is the intravenous, and we will know why in the pharmacokinetics, but the gentamicin is also available as topical formula. And the gentamicin causes irreversible nephrotoxicity as a side effect. So irreversible nephrotoxicity, and that would make it different from the other aminoglycosides. We also have the tobramycin. Tobramycin is of half-life of 2 hours. The tobramycin is available as inhaled formula, as well as the IV formula, which is the main formula. It is also available as inhaled for a treatment of respiratory tract infections. For treatment of respiratory infections. And it is active against the Pseudomonas. Active against Pseudomonas. Other agents that we have is the neomycin and the paromomycin and those both of 3 hours half-life, and they are not used intravenously because they cause severe nephrotoxicity, so not used intravenously because of the nephrotoxicity that they cause, but they are used in other formulas such as the oral formula that we will discuss in the therapeutic uses. And finally, we have the amikacin. The amikacin is of 5 hours half-life, and it is semi-synthetic agent, and it is used when there is resistance to the other aminoglycosides, because this drug is relatively new and there is not a lot of resistance against it, so it is used in case of resistance, And now let's talk about the pharmacokinetics of the aminoglycosides. Let's start with the administration. So administration. The aminoglycosides are not absorbed orally, so there is no oral formula for the aminoglycosides, and the main formula, as we said, it's the intravenous formula, but they are not absorbed because of 2 reasons. First, they are ionized, positively charged molecules, charge. And the second reason is that they contain many OH groups, and that make them more water soluble than lipid soluble. So more water soluble, and the absorption favors the lipid solubility. And if the molecule is more lipid soluble, more oral soluble than more water soluble than lipid soluble, it would make it less absorbed. So those are the 2 reasons of why they are not absorbed orally, and the main formula is the intravenous formula. Main formula is intravenous. And now let's talk about the distribution of the aminoglycosides. First of all, they don't cross the blood-brain barrier. So don't cross the blood-brain barrier even in meningitis. But they are given intrathecally in case of meningitis, in case we need them, because there is no way they are crossing the blood-brain barrier. But they do cross the placental barrier. They cross the placenta and they cause deafness to the fetus. So they are not used in case of pregnancy. And they also cross into the lactating milk, and they are compatible with lactation because they are not absorbed by the baby. So they are compatible with lactation because they are not absorbed into the baby intestine. So compatible with lactation. The metabolism of the aminoglycosides is in the liver, and the excretion is in the kidney. So excretion, it is in the kidney because they are water-soluble molecules, so they would be excreted by the kidney. And the other point is that they are excreted unchanged or in the active form. So excreted in the active form especially in alkaline urine. In active form, especially alkaline urine, and that would make them very good in treating urinary tract infections, good in UTIs. Now let's talk about the mechanism of action of the aminoglycosides. First of all, they work mostly on the gram-negative bacteria. So work mostly on gram-negative bacteria. And as we mentioned before, we have 30S and 50S ribosomal subunit of the bacteria. The aminoglycosides bind into the 30S subunit, so bind to 30S in irreversible and strong bond. So irreversible bond, and that would make them bactericidal. Now let's explain why would they work on the gram-negative bacteria. So the outer membrane of the gram-negative bacteria, which is this here, so we have plasma membrane, we have cell wall, and we have outer membrane of the gram-negative bacteria. So normally the outer membrane is negatively charged. Outer membrane, negative charge, and the aminoglycosides are positively charged. So they would go and stick into the outer membrane of the gram-negative bacteria. And this is stage 1 of the mechanism of action. They stick into the outer membrane. Now, when the bacteria require nutrients, it opens the pores in the outer membrane. So it opens these pores in the outer membrane, and it allows the drug to enter the bacteria, thinking that the drug is the nutrients because it has an amine group here. But in fact, it is the drug that is going to kill the bacteria, and that's when we reach stage 2. The drug enters through the pores, through outer membrane pores. And when the drug would enter, it would work on the ribosomes, and that when we reach stage 3, when it binds into the 30S subunit and inhibit protein synthesis, so bind to 30S. Now let's talk about the dosing of the aminoglycosides. So the aminoglycosides is bactericidal in any concentration above the minimal inhibitory concentration. So aminoglycoside is bactericidal in any concentration above the minimal inhibitory concentration. The aminoglycosides exhibit concentration-dependent killing. So exhibit concentration-dependent killing, meaning the more concentration above the minimal inhibitory concentration, the more killing to the bacteria. So more concentration means more killing to the bacteria. The aminoglycosides also exhibit the post-antibiotic effect. So post-antibiotic effect, meaning that the aminoglycosides stays in the macrophages and infection sites after the plasma concentration of the drug is diminished. So post-antibiotic effect means that the aminoglycosides stays in plasma, in macrophages and infection sites, even after the drug levels decreased. After drug levels in the plasma decreased or diminished. I talk more about the antibiotic or about the post-antibiotic effect in the first video of this series. Now, in the past, the aminoglycosides, the dosing of the aminoglycosides used to be twice per day. The dose is divided into two different times, but nowadays the dose is only once per day, and that's because the concentration dependent killing, the more concentration, the more killing, and that there is less nephrotoxicity with one daily dosing. So it is now the aminoglycosides one daily dose, and it is better than twice because of the concentration dependent killing and the less nephrotoxicity. Nephrotoxicity than the twice dose. Now let's talk about the spectrum of the aminoglycosides. We mentioned before that it works on the gram-negative bacteria, so work on aerobic gram-negative bacteria, and including the multi-drug resistant, including multi-drug resistant Pseudomonas aeruginosa and Klebsiella pneumonia, and Enterobacter species. They also work on gram positives, but they are not as effective as the penicillin and the other cell wall inhibitors, but not effective as the cell wall inhibitors. They also work on the Mycobacterium tuberculosis, and the streptomycin is among the first line to treat Mycobacterium tuberculosis. Streptomycin is one of drugs that are first line to treat tuberculosis. And they also are combined with the penicillin and we get synergistic effect. The penicillin would destroy the cell wall, and the aminoglycosides would enter the cell and inhibit the protein synthesis. So combined with penicillin, and we get a synergistic effect. Now let's talk about resistance, the resistance against the aminoglycosides. We have different resistance patterns against the aminoglycosides, including the efflux pumps, the decrease intake, and we also have the enzymatic inactivation. And amikacin is the least vulnerable to resistance. So amikacin, least vulnerable to resistance. Now let's talk about the therapeutic uses of the aminoglycosides. So they work on any gram-negative infection. They work on gram-negative infections like the urinary tract infections that are caused by the E. coli, Klebsiella pneumoniae, and the Pseudomonas. They also work on the respiratory tract infections, the septicemia, and the meningitis. And in case of the meningitis, they are given intrathecally. They also work on the tuberculosis, and that's by the streptomycin. And they work on the plague and brucellosis, and that's also by the streptomycin. We have the neomycin. Neomycin is given orally. Remember that the neomycin, when given orally, is not absorbed, and that's the case of all of the aminoglycosides, but it is given orally for a reason. That's before the surgery to the intestine, before intestine surgery, just so it clears the bacteria there. And it's also given in case of hepatic encephalopathy, to kill the bacteria that are making or producing the ammonia in case of the hepatic encephalopathy. Paromomycin is also given orally, but for a different reason, and that's to treat intestinal amoebiasis. And the amoeba is a protozoa, but the paromomycin is also works on the protozoa, and it leads to inhibition of the amoeba and lead to treating of the intestinal amoebiasis. The gentamicin is often mixed or combination with another antibiotics. So gentamicin often used in combination with another antibiotics. To treat infections like subacute bacterial endocarditis, and we use the vancomycin plus the gentamicin. And in case of the peritonitis, which is a mixed infection, we use different antibiotics here. We use the penicillin for the gram positives in case of the peritonitis, and we use the gentamicin for the gram-negatives, and we use the metronidazole for the anaerobic bacteria. Metronidazole. Now let's talk about the adverse effects of the aminoglycosides. The adverse effects are collected in the mnemonic NNN from amino. So the N here, NNN. So the first N is for nephrotoxicity. So the nephrotoxicity in the aminoglycosides, in the first, it starts as reversible nephrotoxicity due to charge difference between the aminoglycosides, which has a positive charge, and the kidney proteins, which some of them have negative charge, and that lead to nephrotoxicity, reversible in the beginning, but then it becomes irreversible. And it also, the nephrotoxicity is worse when the patient is old age and when there is another drug is used in combination with the aminoglycosides, another nephrotoxic drug that is used. The other N in the mnemonic is for nerve toxicity, and in case of the aminoglycosides, it is the 8th cranial nerve, which is the vestibulocochlear nerve. And this will lead to deafness by the vestibular part, or the cochlear part, sorry, and vestibular dysfunction when the vestibular part is affected. Vestibular dysfunction that would give us vertigo as a symptom to the patient. Vertigo and dizziness. And same with the nephrotoxicity. The ototoxicity starts as reversible, but then becomes irreversible. And it is worse when the aminoglycosides are used with another ototoxic drug, and it is worse when the ototoxicity occur in people who are old age. The third N is for a neuromuscular block. So neuromuscular block, the aminoglycosides would cause a mild block to the innervation between the muscle and the nerve, and that would give us muscle weakness in people who are after surgery, and in case if the person is having myasthenia gravis, this would make the muscle weakness even worse, and it is reversed by using neostigmine or another reversal drugs. Now let's talk about the contraindications to the aminoglycosides. So the aminoglycosides are contraindicated in case of people who have renal disease and who have auditory problems, auditory or vestibular problems, because the aminoglycosides are nephrotoxic and ototoxic, so not given to those type of people. The aminoglycosides are not combined with another nephrotoxic drug like the cephalosporins, so not combined with cephalosporins because both of them are nephrotoxic, and not combined with the low diuretics, not combined with low diuretics because both of them are ototoxic, and they are not given to patient with myasthenia gravis because they cause muscle weakness, and they are not mixed with any drug in the same syringe, so not mixed with any drug in the same syringe because they have a different charge, and mixing them with a drug that is have another charge would deactivate both of those drugs. So they are not used this way. And with that, we reach the end of this video. Thank you guys for watching. Please subscribe and like this video. We have other videos like this video for the other antibiotic topics. So if you want to check them, they are linked in the description. And with that, thank you guys for watching, and see you in the next video. Peace.